To manage the blood glucose, the insulin has to be given from outside. In this condition, so we need to give agents which promote the action of the insulin, which also have a very protective role on the heart and the kidneys as well. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist in the Department of Endocrinology, Ramaya Medical College and Ramaya Memorial Hospital. So today we'll talk about what the treatment options are available for the management of type 1 diabetes, type 2 diabetes and the other forms of diabetes. So as we discussed earlier, type 1 diabetes is a disorder where there are autoantibodies produced against the pancreas, which causes the pancreatic function to decline and the insulin production to go low. So this results in a state where there is insulin deficiency in the body, and hence to manage the blood glucose, the insulin has to be given from outside. That is the exogenous administration of insulin. And insulin is usually in these patients are given as a regime called the basal bolus regime, wherein we give insulin, that is the short-acting insulin 3 times a day, and the long-acting insulin is given once a day. So this results in a very good blood glucose control, and the modification of the insulin can be fine-titrated when the insulin is being given 3 times a day. So, but there are different studies which have compared patients who are on twice a day insulin and the patients who are on 4 times a day insulin. And it has been documented that whenever insulin is being given 4 times a day, the blood glucose control is very good as compared to twice a day, and the complications related to diabetes also can be reduced to a very great extent when the insulin is being administered 4 times a day. So patients are usually reluctant when we tell that these patients have to be on 4 times a day insulin. But with the advent of the pens, with the ease of administration, it becomes very easy for the children and other patients who are having type 1 diabetes to administer insulin. So apart from this option, for the management of type 1 diabetes and also for the management of type 2 diabetes as well, we have the insulin pumps also available. So insulin pump is a device which the size of which is almost like that of a smartphone, which can be kept in the pocket, and the insulin is being delivered continuously through the subcutaneous route. And also the blood glucose also will be monitored at the same time with the help of a device called the CGM device, that is the continuous glucose monitoring device. And there are different pumps available, and some of the latest pumps available which can automatically adjust the insulin delivery as per the blood glucose levels. So this is about the management of type 1 diabetes. So now coming to the management of type 2 diabetes, as I said earlier, type 2 diabetes is basically an insulin resistant state. So insulin resistance usually happens when there is excessive weight, and this excessive weight could be due to a lack of the diet modification, lack in the exercise schedule, or use of a lot of processed food. And also it can be familial as well. So in this condition, so we need to give agents which promote the action of the insulin. And sometimes patients, when they are having type 2 diabetes for a very long duration, the insulin secretion tends to come down, and because of which the insulin has to be given from outside again. So first, when patients newly diagnosed with type 2 diabetes come to us, we usually add agents which will increase the action of insulin. So these are called as oral anti-diabetic drugs. So there are different oral anti-diabetic drugs. We have metformins, we have sulfonylureas, we have glepaglynide, nataglinide as well, and we have other agents called the pioglitazone, and we have other agents called the gliptins. So as I said earlier, type 2 diabetes could be due to excessive weight as well. So in these conditions, we need agents which can promote weight loss, because of which the insulin action can be enhanced. So for this, we have other good agents called the SGLT2 inhibitors, which are available in the market, which also have a very protective role on the heart and the kidneys as well. There are lots of data which suggests that this SGLT2 inhibitors are also helpful for the liver functioning as well. So that is about the treatment options available for type 2 diabetes. Also, these are the oral anti-diabetic drugs. And now we have different agents, in fact, which will promote weight loss. We have drugs called the GLP-1 analogs. We have dulaglutide, liraglutide, and even semaglutide, and also the latest molecule which is available called the tirzepatide, which can be given to type 2 diabetes, which will result in weight loss. So with the weight reduction, what happens exactly is the pancreatic fat tends to come down and the liver fat also tends to come down. So when the pancreatic fat declines, the insulin secretion automatically improves, and when the liver fat declines, the insulin action also tends to improve. So for the management of type 2 diabetes, we can put patients on oral anti-diabetic drugs and also the GLP-1 analogs, which have a weight loss efficacy as well. So now coming to the management of type 3C diabetes. So type 3C diabetes, as I said earlier, is due to the disorders involving the pancreas. So when the pancreas are involved, the insulin secretion from the pancreas also tends to decline. And hence the mainstay of treatment for this pancreatic diabetes is again insulin. So, and for the management of type 5 diabetes, which is, as I said earlier, is nothing but lean diabetes or malnutrition related diabetes, improving the nutrition becomes the most important management. So improving the nutrition in the form of high protein diet is definitely going to be helpful. So for the management of these patients, usually the patients might require insulin along with metformin, and along with that the nutritional component has to be addressed. So this is about the management of type 1 diabetes, for which insulin is the mainstay of treatment. For type 2 diabetes, wherein we have oral anti-diabetic drugs and also GLP-1 analogs, and if the blood glucose is not being controlled, or if there is a long history of type 2 diabetes, some patients might require insulin. And for the management of type 3C diabetes, again it's the insulin, and for type 5 diabetes, nutrition. So with that, we conclude. Thank you. And in the next episode, we'll be dealing with what the precautions related which we can take in order to prevent diabetes.